Welcome to AI Arthritis Voices 360. This is the official talk show for AI Arthritis, which is short for International Foundation Autoimmune, Autoinflammatory Arthritis. And we are an international organization that focuses on the autoimmune and autoinflammatory arthritis diseases to make sure that patients and everything that patients need to improve their healthcare is driven by those living with the conditions, just like me. I'm a person living with non-radiographic axial spondyloarthritis and also the CEO of the organization. And today I have very special co-hosts with me today, Miss Vanessa. Hi, Vanessa.
Hey everyone, thank you so much for joining and listening in. My name is Vanessa Lathan and I'm the Grassroots Advocacy Manager here at AI Arthritis, as well as the Patient Inclusion and Counsel Lead. I'm looking forward to chatting with you today, Tiffany.
All right. Now, Vanessa puts up a very important phrase here. What is the Patient Inclusion Council, you may ask? So you may or may not know, in the United States in particular, there is a lot of work around prescription drug affordability. Now, I'm going to timestamp this. We're talking in the fall of 2025. Efforts started about a year ago, both federally at the Centers for Medicare and Medicaid Services, but also states at various states. And a lot of these efforts have been underway with trying to identify ways to save on prescription drugs, but who's saving, right? And it could be saving for the state, the healthcare system, insurance companies. We care that it's saving for patients. We care that money is being put back in the pockets of patients. Now, of course, we want a very healthy healthcare system, but we're here for the patient voices. We're here to make sure that people have access. And so because of that, there is a coalition in the United States covering these efforts, and it's called Ensuring Access Through Collaborative Health, or EACH, which has patient organizations like AI Arthritis and probably any other patient organization that you may be affiliated with, as we have over 80 groups under this umbrella, and then the Associated Patient Inclusion Council, the very first ever patient caregiver coalition. What? It's true. And Vanessa is the lead of it. Matter of fact, AiArthritis is the lead of the entire coalition. What? Again, it's true. So we are really, really excited to be talking to you about this today. Now, this is a 360, which means it's a spinoff conversation of another episode that aired called What the Health? I love that name. It's WTH capital lowercase ELLTH. And that is also another initiative by AiArthritis that is disease agnostic, meaning any condition. And if you're frustrated about the healthcare system, that is an international one. Whereas what we're going to talk about today is USA specific, but make sure you check out What the Health, because we are all about healthcare reform and making sure to put money in the back in patient pockets. So we're going to go ahead and get started. And I talked a lot here to give you the introduction. So I'm going to actually just flip it over for Vanessa, just to give you a little bit of a background of why we're talking to you today. What are we trying to achieve? So Vanessa, why don't you tell everyone a little bit more about the PIC, the Patient Inclusion Council, and our overall goals here?
Sure. Thank you, Tiffany. And I always forget this, but I would like to add that I am also a person living with an autoimmune condition, among other invisible disabilities, as well as a previous caregiver for my grandmother about 2 years ago until she passed away. So the goal of the PIC, which I really look at as treating the whole person, normalizing that patients and caregivers, we are enough to drive policies that improve our quality of life. And I like that we're taking the stigma away that, patients we're more than just storytellers. We are actually driving impact. And that is what the Patient Inclusion Council, or PIC for short, is here to do, is really to help us a safe space to give caregivers and patients the tools they need to advocate for policies, which one of the main things that the PIC focuses on is medication access and affordability. If you're out there right now, wherever you are in the world, raise your hand, drop a comment in the chat if you are struggling to afford your medication. You're struggling to afford your bills. You have to decide between putting a grandchild in school or a daycare facility or picking up your medications. You may not have access to your medications because you don't have your car, you're in a rural neighborhood, or you may not even know the medications that are available to you because sometimes these conversations aren't had with diverse communities. The PIC is here to address those issues and really get down to why medications are unaffordable, why medications are hard to access, because we recognize we're living in times where costs are high and medications are high. So we're here to really hear from the patient, not third hand, not what people think, not to assume. We want to hear from you all out there, all the patients, because at one point all of us have been a patient. If you're living with a acute, chronic, or rare condition, the PIC is here to hear your why, to hear your challenges, and even your success about medication affordability.
Well, show over. That was perfect. No. So, Vanessa, thank you so much for sharing that. That is such a great summary of why we're here today and why we felt the need to do this 360 and off of the What the Health episode. And so with the Each Pick Coalition that AI Arthritis is leading, we are joining forces with many other patient organizations and allied groups who are part of this coalition who have signed up to also be part of what we're calling a podcast train. And so we are all so invested in making sure that the patient voice is heard in all of these efforts to improve prescription drug affordability. They're happening. This is happening right now. And the thing is these groups that are trying to figure out drivers of affordability, drivers that are really causing this prescription drug affordability so they can create solutions, are asking patients, please tell us, please tell us. But what we're realizing is not enough patients are participating. And what's the result is going to be changes that don't involve our why. They won't involve, if I am skipping or stretching a medication, for example, this has happened to me because my insurance company didn't apply my manufacturer copay assistance program for 3 months. That's my why. I can't afford the out of pocket cost for that medication. But if I don't say that, and the other people who are experiencing that don't say that, it's not identified as a driver of affordability challenges, right? Just like Vanessa said too, if you can afford your medications, that is just as important to hear. The current efforts are not asking for that, but let me tell you why that's important. Let's not fix what's not broken. First of all. And second of all, let's learn from successes. So if something is working for the exact same medications that some can't afford, why can some afford them? Patients are the ones that need to explain that. So we have launched a patient-led, it's called a patient experience data. So we're collecting information. It's more than stories. It is your story, but it's in a way that is in this case, this effort in fall of 2025, our first effort. So if you're listening to this a few years ago, it's okay because I guarantee you we've had many, many more of these exact same data collection since then. So if you're tuning in now, we need you to take our 10-minute survey, which is capturing your prescription drug affordability or unaffordability. Why? Why can you afford this? Why can't you afford this? We did a pilot study over the last year and the findings were unbelievable. I mean, and Vanessa, feel free to weigh in on this too. Some of the things that we learned was patients were saying, I pay $0 to $10 out of pocket, but it's not affordable. And we had to say, thank goodness we asked why, because the current surveys are not asking why. They're just saying, oh, well, unaffordable, unaffordable, unaffordable. Okay, well, why? Many of the people said $10 is not unaffordable, but I have 11 prescriptions. That's a why, right? What are some of the other things, Vanessa, that kind of stand out to you of whys, the things that why, the things that we have to capture from patients so we can help solve the problems?
Yeah, I want to definitely add on to where you just left off. One of the things that I absolutely love about the pick, and I'm sure I said this already, is how we're treating the whole person. If you're just dealing with an autoimmune condition or autoimmune medication, you may be ignoring the fact that this person is living with diabetes, is a cancer survivor, you know? So when Tiffany was sharing that when you have 15 plus drugs at $10 and you need other things like maybe a heat pad if you're living with chronic pain, it all starts to add up. So we're trying to teach the government, the powers that be, how we want our healthcare to be and how we want to show up and realize that we're not just showing up as a patient living with one condition, we're living with multiple. I think what we're also seeing too is that how sometimes the healthcare system, health policy talks to each other. It doesn't talk in a language where the average person that's not doing this every day can understand. We all will receive our medical records or insurance bills and are like, what is all of this? It's so much language. We're using jargon and acronyms that people don't understand. And I think that one of the things that this survey is getting at is number one, having clear, common language that everyone can understand and trying to understand a definition around what does unaffordable mean to you? What does affordability mean to you? And having those conversations and creating a safe place where people to ask questions and not just assuming you missed your dose because you just didn't want to take it. I think also, too, people don't realize the options that are available to assist them with getting their medications because maybe their doctor didn't tell them or their doctor told them and they were afraid to ask a question and say, hey, I don't quite understand what you mean. So I think what we're learning is that when you equip patients, when you equip people with the tools that they need to be successful in advocating along their healthcare journey, they will do it, but they're just missing some of the pieces in order to advocate and truly understand the healthcare system, as well as the healthcare system and the community are not talking to each other.
Absolutely. That was a really important theme. Thank you for bringing that up, Vanessa. In our pilot study that we did 2024 to early to 2025, we were asking, please tell us your why. Why can or cannot, why can't you or can you afford your prescription medication? And we heard from a lot of patients who said, I did not even know that there was financial assistance. And one of the things we realized is the language associated with those plans themselves it's very confusing. There's some that are called manufacturer copay assistance programs. There's some that are just called financial assistance. There are some that are called patient assistance programs. And some organizations have these separately than the manufacturers. There's so many, and that in itself is confusing. So one of the things that we took from that is as patient leaders, we will be working with other organizations to really help facilitate that type of education to make sure patients know, please, if you can't afford your medications, let's first see if there is some kind of financial assistance, because we did find that of those paying 0 to $10 a month, 88% used some form of financial assistance. What does that tell me? That is an example of what can make a prescription drug affordable. If it helps affordability, we need to lean into that, right? And so those are the kind of things only patients can tell. Your type of health insurance might matter as well. It could matter if you're employed, you're unemployed, you're on Medicare, you're on individual. There's so many different types of insurance too. So understanding that is going to be really important. Many, many moving parts here. But the important part is that you as a patient, you as a person, any condition, whether it is an autoimmune or autoinflammatory arthritis disease or not, AI Arthritis is participating with many organizations around the nation to get the word out of this. We do lead the TPIC Coalition, who is leading this effort to get more patients to the table, but we are here today as a participant alongside 80 organizations, 80 plus, who are unified in this effort to make sure your voice is counted. We're just kicking off the podcast train. And so in saying that, how do you get involved? Why should you get involved? I think we've talked a little bit about the why, but how? So if you go to our website at eachpick.org, you are going to see a link to the patient experience project. It's right there on our website. Regardless of when you hear this, there's always going to be our website, and there's always going to be a tab, if nothing else, to learning more about the Patient Inclusion Council and ways you can get involved. So make sure that you check that out. You will be able to get to the survey that way. For those of you who are tuning in at the end of 2025, this particular survey ends October 31st, 2025, about 10 minutes. You can get to it directly as well by going to bit.ly/patient-y. That's bit.ly/patient-y. It is vital. We want to get hundreds, because the more we get, the more drivers we can identify. And then we go to the people changing, improving, and saying, this is what patients say need to happen in order for change to really put money back into our pockets, right? So that's what we're looking for. Vanessa, do you have anything else to add?
I just want to say to everyone, please, 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 please take the survey. Pause the podcast right now. Take the survey. Come back. I always like to say, post it on social media, sharing, reposting, sending an email is free. Send it to anyone and everyone you know. I know it's not always easy to tell your story. You may not know how to get involved, but we're here to help you. And we are peers. We are patients too, and we are helping you. We are in the fight with you. We are demanding change. We are taking our power back. We are taking our voice back, because nothing for us without us. But we need you in the fight with us. So please, anyone and everyone you know living with any and all health conditions, please, please, please send them to the pick and tell them to take our survey. We want to hear from you. We're waiting to hear from you. So if I don't hear from you, I'm going to be upset. Okay. So please, please, please take the survey.
Yes. So signing off here on behalf of the Each Pick Coalition, AI Arthritis as a lead of that coalition, and unified front with 80 plus organizations around the United States, asking you, please, if you have a chronic condition, please participate in this. It is vital. People are listening. Change is happening. We need to make sure that anything that is involving issues that could potentially impact our lives must include our voices. So thank you again for tuning in. Until next time, we appreciate your support for AI Arthritis Voices 360 and these associated 360 its. Thank you so much, Vanessa. Thank you, everyone, for tuning in, and we will see you soon. Thank you so very much.
All right. Thank you. Take the survey. Woo!